Well, good afternoon. Swedes are a tough act to follow. What I'm going to do is provide you with a roadmap or explain a way to solve the healthcare crisis in the United States. I've got 10 minutes, so plug your brains in. Little healthy skepticism is probably in order already, but I'm going to describe a system that can provide quality health care for everyone in our society, very equitably distributed, and at a much lower cost than we now spend in the United States. First, a little time of the mess. As you know, our healthcare system is a mess. We spend about 17% of our gross domestic product on healthcare in the United States. Over the last 20 years, it's gone up from 10 to 17%, nearly doubled. The government, keep this number in mind, the government pays about half of that, and private citizens through insurance largely and out of pocket pay the other half. We in the United States spend more per capita than anybody else on healthcare by a long margin, and yet when you look at the results of our healthcare system, we rank, one statistic I found says that we rank 22nd out of 23 of Western industrialized nations in the quality of our healthcare, and as you know, Obamacare notwithstanding, there are still millions of people in America who don't have access to healthcare. So, this is a graph of what's happened to healthcare costs since 1970. The top sort of puke yellow line is the United States, and we've gone up at a remarkably and dramatic rate in terms of the cost of healthcare in our nation compared to other westernized industrial high healthcare societies. Germany, Switzerland's in there, Canada's in there, and you can see that they all cluster around 10% of their gross domestic product. And they're delivering better health care than we are in America. So at the first level, if you say, could we reduce health care costs, the answer would be, yeah, one version, we could at least get to there. That, you know, other people are doing it and it's possible. If you look at the amount our federal government spends on health care as a proportion of the federal budget, in 1970, health care was about 7 or 8% of our federal budget. Last year, 2013, it was now 24% of the federal budget. 1 in every 4 federal dollars is spent on health care. Health care costs in America are literally sucking public money away from anything else as a society that we'd like to spend for other than health care. So education, infrastructure, development, heaven forbid, actually reducing taxes or reducing the deficit or the debt, anything else you can think of that public money could go to, healthcare is sucking that money away into its great sort of behemoth mouth. So this conference is what is next. I'll tell you what is next in the United States in healthcare, unless we radically redesign the system. What is next in healthcare is that costs will continue to rise. And we'll have a fight as a society over who's going to pay for it. And we'll frame that fight as though it were a choice between you as individuals, business, largely through insurance, or the government. I got a clue for you. They're all your wallet. They're just different pipes to your wallet. So there'll be a big shell game about that, but we're really talking about you will pay for it. We will, in an attempt to control the monster, and we already have, as you well know, we will create an ever-increasing bureaucracy that tries somehow to tame this, and if 20 or 30 years of experience is worth it, it won't work. And you will have health care rationed. You already do, but count on it. Your health care will be rationed, because it'll be the only way under the current system that they will get to any kind of control of costs. And you will not have much say in the matter. So are you skeptical that we can take money out of the healthcare system? I have a playful little example for you to consider here. I'm going to do 2 ovariohysterectomies in the United States. Both are in a 120-pound female. Both involve an abdominal incision under general anesthetic. Both are sterile surgery. Both have a very high rate of success. And in America today, one costs $400 and the other costs $12,000 on average. What's the difference? The difference is the $400 one's a dog. And the $12,000 one is a human being. So, you tell me which of those two is abdominal surgery, which one's human and which one's veterinary. They're virtually identical as a surgical procedure. They use the same anesthetic, the same gloves, the same suture, the same, all of the medical stuff that's used is purchased from exactly the same suppliers. And yet veterinarians have figured out how to do that and make a living at $400. And veterinarians, not public money, build their own hospitals. They pay their own staff. They pay profit on their income. And yet they're able to provide that medical service for about 3% of the cost that we provide it in humans. Something's rotten here. Now, I don't want to push this analogy a little too far because my wife's in the audience. I do not want my wife kept in a kennel or fed kibble. So there are clearly differences. But are those differences so great that they amount to 97% of the cost of health care? I don't think so. I think the fundamental difference is if you're going to take your dog to the vet, you ask how much it costs. And you pay out of your pocket. And so over a very long period of time, you and the veterinarian have worked together to figure out ways to deliver quality care at the smallest possible price, and veterinarians compete amongst themselves for you to buy your medical veterinary services from them. Let's think about human health care. How many of you have had a health care event in the last 6 months? Gone to the doctor, had a test, bought a prescription? All right, how many of you can't raise your hand because you're medically hindered? Okay, I think it's virtually over. Now raise your hand if you knew what that cost, that medical service cost. Not what you paid as a co-payment, but what the whole thing really cost. Raise your hand. Almost none of you. Imagine that food was procured by going to the grocery store and you didn't know what it cost and you took home what the grocer recommended to you. What would happen to the price of food? That's our healthcare system, so I'm going to fix it. I'm going to advocate a 3-tier medical system. Tier 1 is basic, proven, cost-effective preventive care we want everybody to get. The government pays for that because we want nobody inhibited from getting a flu shot or well baby care or maybe annual checkups. We could have a fight with people about whether that's warranted or not. But basic health care that we want everybody to get, that's Tier 1. Tier 2 is where the fun happens. In Tier 2, every time you go to the doctor or consume medical services, you pay half of the bill out of your pocket. The government pays the other half. So if you're going to do any healthcare services, essentially everybody in America, after whatever, January 1st, when they go to the doctor, they know half the cost is coming out of their pocket. I can tell you what will happen to the cost of healthcare under that circumstance. It will drop like a rock because you'll start asking questions, you'll start paying attention, and your provider will compete for your business on the value of their care and the price of their care, just like they compete for everything else in our society except health care. You would be limited in Tier 2, however, to paying half of the bill up until you had paid 10% of your taxable income. And this is where equity comes in. If you don't earn much money, you don't spend a lot of time in Tier 2. If you're Bill Gates, you never leave Tier 2. In fact, if I do the math, about a half of American families never leave Tier 2. So at the beginning of the year, essentially everybody's in there, and by the end of the year, half of the consumers are still in there, and providers have to figure out how to get your business by competing on dollars. When you leave Tier 2, because you've spent 10% of your taxable income, you enter Tier 3, and that looks roughly like our insurance company coverage now. The government pays that bill. The trick, though, is the prices in Tier 3 would be required by law to be the same as the prices in Tier 2. So the competitive activity in Tier 2 would keep Tier 3 costs down because we would have set prices in Tier 2 in a competitive market. So if you were a family earning $60,000 a year and you had $8,000 of total medical care expenses in the year, you would pay $4,000 out of pocket, the government would pay $4,000, and at the end of the year that would be it. If you had more health care, you'd continue to pay half of the bill until you'd spent $6,000 out of pocket, and in total, you'd consume $12,000 worth of health care. And then you'd go to Tier 3. So what, you wanted something more complex? That's it. Okay? There will still obviously be important decisions to be made. There's lots of devils and details in here, and it will be remarkably simpler than our current healthcare system and remarkably more cost effective, and we would drive the cost of healthcare down in a heartbeat in our society. Because you, the consumer, and your provider would get together and say, how do we do this cheaper, because otherwise you're not going to be my customer. So everyone would have access to health care. Everyone, because of Tier 3, would be protected in cases of calamity or high expense chronic care needs. Payments for health care would come out of your pocket, but you'd know it. okay, or from the government, which would be your taxes. There would be no medical insurance as we know it. So businesses that are now paying for medical insurance would give you some of that money into your pocket in wages, and they would give some of that money to the government in increased, I don't know, Medicare taxes. Okay, the money's going to come from somewhere, but that's what would happen. Okay, and consumers of health care, all of you would factor cost into the decisions you get for health care, and maybe even thinking about that cost, you'd pay attention to how healthy you stayed, because you knew when you got sick it was going to cost you. So here are my closing questions. As a society, would we like to spend substantially less on health care and distribute it more equitably across the whole society? Would you as an individual like to have a lot more control over what you consume and how you spend your money for health care? And to achieve that, would you be willing to include the cost of care in your decisions? Notice I'm not saying would you be willing to spend more, because it's all pipes to your wallet. I'm really saying you're going to spend less, but would you like to have a say in the matter about where it went? If so, I think there's a simple way to get there. Thank you.